talk about early onset balding in men. If you're noticing thinning in your 20s or early 30s, take a breath. You're not imagining it, and you're not alone. Early hair loss is extremely common. Most men just don't talk about it until the barber starts adjusting angles or the lighting in photos becomes strategic. Early onset balding usually refers to noticeable thinning before age 35. It often begins with a receding hairline, thinning at the crown, or gradual loss of density across the top of the scalp. The most common cause is genetics. This is known as male pattern baldness or androgenetic alopecia. If men in your family experienced early hair loss, your follicles may be genetically sensitive to a hormone called DHT. DHT is derived from testosterone. It does not mean your testosterone is too high. It means your follicles respond strongly to DHT. Over time, DHT causes follicles to shrink in a process called miniaturization. The hair produced becomes thinner, shorter, lighter in color, and eventually stops growing. This happens gradually. That's why many men only realize what's happening once significant density has already been lost. Now let's talk about other contributing factors. Severe or prolonged stress can trigger temporary hair shedding, known as telogen effluvium. This typically occurs 2 to 3 months after a major stressor, such as illness, surgery, emotional trauma, or extreme lifestyle disruption. The key difference is that this type of shedding is diffuse and often reversible. So no, one stressful week did not make you bald. But chronic stress can absolutely influence your hair cycle. Nutrition also plays a significant role in hair health. Hair is primarily made of keratin, which is a structural protein. If protein intake is inadequate, your body prioritizes essential organs over hair production. For most adults, adequate protein intake is roughly 0.8 to 1 gram per kilogram of body weight daily. If you are highly active, it may be slightly higher. Good protein sources include eggs, chicken, fish, lean beef, Greek yogurt, beans, lentils, tofu. Consistency matters more than occasional high-protein days. Now let's discuss iron. Iron is critical because it carries oxygen to tissues, including hair follicles. Without adequate oxygen, follicles function poorly. Iron deficiency is one of the most common nutritional deficiencies globally. Iron-rich foods include red meat, liver, spinach, kale, lentils, chickpeas, pumpkin seeds. Iron from animal sources is absorbed more efficiently than plant sources. If relying on plant-based iron, pairing it with vitamin C, such as citrus fruits or bell peppers, improves absorption. If you experience fatigue, dizziness, pale skin, and hair thinning together, testing iron levels may be appropriate. Next is zinc. Zinc supports hair tissue repair and regulates oil glands around follicles. Low zinc can contribute to shedding and poor scalp health. Zinc-rich foods include oysters, beef, pumpkin seeds, cashews, chickpeas, whole grains. Biotin supports keratin production. True biotin deficiency is rare, but when present, it can cause thinning hair and brittle nails. Biotin sources include egg yolks, walnuts, sweet potatoes, salmon. Vitamin D plays a role in regulating the hair growth cycle. Low vitamin D levels have been linked to certain types of hair thinning. Sources include sunlight exposure, fatty fish like salmon and mackerel, fortified dairy products, egg yolks. Supplementation should ideally be guided by blood testing. Omega-3 fatty acids reduce inflammation and support scalp health. Chronic scalp inflammation can negatively affect follicle function. Sources include salmon, sardines, flax seeds, chia seeds, walnuts. Now let's transition to treatment. Minoxidil is a topical treatment that increases blood flow and prolongs the growth phase of hair follicles. It does not block DHT, but it helps follicles perform better. Results typically take 3 to 6 months of consistent use. Stopping treatment usually leads to gradual loss of the gained hair. Finasteride works differently. It reduces DHT levels by inhibiting the enzyme responsible for converting testosterone into DHT. This slows or halts miniaturization in many men. It is prescription-based and requires discussion with a healthcare professional. Now let's talk about microneedling. Microneedling involves using small needles to create controlled micro-injuries in the scalp. These micro-injuries stimulate growth factors, increase blood flow, and may improve absorption of topical treatments. It works best when follicles are still alive but miniaturized. It does not block DHT. It enhances growth signals. Typically, at-home protocols involve shallow needles once weekly, while deeper treatments should be performed by trained professionals. Then there are so-called hair loss blocker creams. Some contain caffeine, ketoconazole, or plant extracts like saw palmetto. Ketoconazole, commonly found in medicated shampoos, may reduce scalp inflammation and possibly mild DHT activity at the scalp level. However, most over-the-counter creams are not as potent as prescription DHT blockers. If a product promises full regrowth in 30 days, approach that claim carefully. Red light therapy, also known as low-level laser therapy, uses specific wavelengths of light to stimulate cellular activity in follicles. Some clinical studies show modest increases in hair density with consistent use over several months. It is non-invasive and generally safe. However, results require patience and consistency. And no, your phone flashlight does not replicate medical-grade wavelengths. Copper peptides are another supportive option. They may promote wound healing, improve scalp health, and reduce inflammation. The research is still emerging. They are best considered supportive rather than primary treatments. For advanced hair loss, hair transplantation is an option. This involves relocating DHT-resistant follicles from the back or sides of the scalp to thinning areas. When performed correctly, results can be long-lasting because those transplanted follicles retain their resistance. And yes, this is why certain international flights are frequently filled with men wearing very careful hats. Lifestyle factors should not be ignored. Chronic sleep deprivation increases stress hormones. Extreme dieting disrupts nutrient availability. Smoking reduces blood flow to follicles. Hair reflects overall systemic health. Here is the evidence-based hierarchy. If hair loss is genetic, reduce DHT, stimulate growth. Support scalp health, correct deficiencies, start early. That combination produces the best long-term outcomes. Now here's the honest perspective. Early balding is common. It is not a personal failure. It is not a measure of masculinity, attractiveness, or worth. The earlier you understand the cause, the more options you have. And here is the final truth. Hair loss is a biological process. Managing it is a medical decision. Confidence is a personal decision. And those are not the same thing. Make informed choices. Act early. Be consistent. And never let marketing be louder than science. If you approach hair loss with evidence, patience, and consistency, you move from reacting emotionally to managing strategically. And that shift makes all the difference.